Hi, it's Brody from B-Mobile Physiotherapy, and in this video I'm talking about tennis elbow. Tennis elbow is the most common pain condition affecting the elbow. It is given lots of different names such as lateral elbow tendinopathy, lateral epicondylalgia, or lateral epicondylitis. To keep things simple, I'll just call it tennis elbow for this video. Tennis elbow is a tendinopathy, meaning it is a condition affecting the tendons. In particular, it is this group of forearm muscles and the tendon at which they attach to the outside of your elbow that is most affected. Tendinopathy, in this case, is thought to be an overload condition, and so tennis elbow is often brought about by repetitive manual tasks where one arm is used more than the other. This may be things like an office worker using a computer or a keyboard, or a manual labourer using a hand tool. However, in many of the cases, tennis elbow seems to originate without any specific causal activity. People with tennis elbow will typically complain of pain on the outside of the elbow that may extend down the forearm and into the hand. The pain can be constant and even occur at night, but often it is provoked by specific activities. Those activities tend to be anything involving gripping or lifting tasks with the affected arm, so things like turning a doorknob, using a hand tool, or using a computer. Weakness of the hand is also a common complaint that goes along with tennis elbow. Tennis elbow can be quite a tricky condition to manage, and unfortunately the research does show that it can often last months or even years. That being said, we do have quite strong evidence that exercise is effective at reducing pain and improving function in people with tennis elbow. The goals of exercises for tennis elbow are twofold. Firstly, to increase the local tissue capacity, so strengthen the muscles and tendons involved, and secondly, to improve the overall strength and function of the whole arm. Okay, so which exercises should you be doing? I'm going to get set up and show you the three main exercises that you can start with to try and manage your tennis elbow. Okay, so there are three main exercises I'm going to show you to start to work on that tennis elbow. The first two, we're going to be sitting next to a table. It's important to have the forearm supported for this exercise with the hand and wrist free to move off. The first one is called wrist extension, so it is lifting the wrist up and lowering it back down, just like so. And of course, we want to add a little bit of weight to this when we can. So we can have a dumbbell is a simple version, holding with the forearm supported, slowly lowering down and slowly lifting up. And we're going to do 8 to 12 repetitions where they should be fairly challenging so the muscles are really working. If you don't have a dumbbell, you can use any simple object from around the house like a bottle. And again, with the forearm supported, lowering down and lifting up for 8 to 12 reps. And we're going to do 3 total sets of that exercise with a minute rest in between. Now for the second exercise, it looks very similar. Again, in this same forearm supported position, but this time instead of lifting the wrist up, we're turning the wrist up. So thumbs toward the ceiling and turning back down. Again, slow and controlled for 8 to 12 challenging reps. To make it a little bit harder, you want to grab the end of the dumbbell with the longer part coming out the side where your thumb is. And again, we're going to rotate up and rotate down for 8 to 12 challenging reps. And we'll complete both of those exercises for 3 sets. Now, one important thing to point out is that for most people with tennis elbow, you will experience an increase in pain and symptoms when undertaking exercises like this. The research shows that that's okay as long as the pain is at a tolerable level for you. If you're having a severe increase in pain from these exercises that's lasting days at a time, then they may be a little bit too much. So remember, the important thing to do is reduce the load, so you can even do this unweighted with just lifting the wrist. And you can just do less of them, so maybe 2 or 3 sets of 5 is all you can handle for now, and then we'll slowly build up and eventually add weight. The third exercise is to get the whole arm and shoulder working a little bit better, and it is a bent over fly. The starting position is standing up. We're going to bow slightly forward and lift the arms up and out to the side and back down. Good. From the side, bow forward, up and out to the side, and back down. Again, we want 3 sets of 8 to 12 challenging reps. So of course we can add a little bit of weight to that once the arms is easy enough by themselves. Bow forward, lift up and out to the side. And it's a smooth, controlled movement up and down. Okay, so to recap, Tennis elbow is a painful tendinopathy affecting the tendons at the elbow. The best treatment we know of is to exercise to increase the strength and capacity of those tendons and of the whole arm. So we would recommend starting with those 3 exercises every second day and progressing. Remember, it's important to note that some pain and discomfort with those exercises is very normal, and as long as it's a tolerable level, then it's okay to continue. So stick to those exercises and you'll start to see some improvement.